Hi, everyone. Thanks for joining us today. Hopefully you can hear and see us now. Sorry, we're running a bit late for today's webinar. But for those who don't know me, my name is Megan Hickey. I'm a bariatric dietitian at Melbourne Weight Loss Surgery, and we're running today's webinar to discuss weight loss surgery and nutrient absorption. So for this topic, we have asked special guest Jacqui Lewis from BN Healthy to join us in this discussion. Jacqui is a clinical director at BN Healthy, and he has extensive experience in the bariatric area. So thanks for joining us, Jacqui.
Thank you very much for having me, Megan. It's exciting to be here, and also just a great opportunity to, I guess, keep top of mind what nutrition after bariatric surgery is all about, and look at it from a kind of a deeper level, and I guess explain kind of why we do things the way we do at Being Healthy as well.
Yeah, amazing. So did you want to start off by showing us like some information around pre and post surgery anatomy and nutrient absorption?
Yes, and please keep time for me. So I will do that. I'll go through the implications of bariatric surgery and nutrient absorption, and how to look after that, I suppose. I'll just show you my, share my screen. Also got, can you hear noise?
Yeah, a little bit of background noise, but it's not too loud. So
yeah, we've got someone next door's gardening. So thank you for the opportunity. And this slide deck, it does go through a lot about kind of background information about obesity and its impacts as well. And I know that most of the audience will be quite familiar, but I wanted to keep it in the slides just so that when we share them, the whole story is there. So we talk about our mission at Being Healthy is supporting those committed to being healthy every day, which is where our play on the BN came from. We did start out, we were called Bariatric Nutrition, and then we just became a bit more than that, and looking at kind of the, you know, living a long and healthy life after surgery and the impact we can make there. So I will skip through a few slides, and just for time consideration, really, we look at kind of how widespread obesity is and its impacts on health, and then when we start to treat it with bariatric surgery. I'll run through also the surgical, that's also like how you qualify for surgery, what the guidelines are. And I will talk a little bit about guidelines around care of a bariatric patient and the nutritional care of the bariatric patient, because that's a lot of the information we draw our, I guess that's how we formulate our products, is around this robust kind of investigation into nutrition for the bariatric patient as well. We look at surgery is the most effective option in achieving sustained weight loss. We know that without surgery, someone in that morbidly obese category, the implications on the endocrine system and the ability to lose weight and keep it off is the main. I mean, weight loss is something, but maintenance is something else, and that's where the bariatric surgery comes in. But we know that it's certainly not a miracle, and there are other things that we need to do. I won't go deeply into the success rates. We know that a gastric bypass patient will lose 77% of their excess body weight in the first year. They resolve 96% of their severe comorbidities or health-related issues that are connected to the metabolic milieu we call obesity. And 98% of patients find that their type 2 diabetes is reversed. So we know that this is a really effective way of bringing about much better health outcomes for patients living in larger bodies. I will touch on this. It's a good visual to draw when we're looking at nutritional and the implications of bariatric surgery on our lifelong nutrition. or our absorption of micronutrients and our health outcomes from that perspective. This is a non-surgical digestive system. We can see there the liver, esophagus, stomach, and the whole digestive system processes food, absorbs nutrients, and does a wonderful job of that. Once we intervene with either a sleeve gastrectomy, we remove about 70% of the fundus or the stomach, and most patients in the audience will be well aware of what that brings. So really we're left with 80 to 100 mils, 150 mils of capacity, and that's great for weight loss. It's also great for metabolic health, where some of those hormones that actually are found in that stomach area are driving hunger and driving, you know, the weight picture that we see with obesity as well. The bypass patients also, they get the restriction, but they also get a little bit more malabsorption. So both surgeries will provide some malabsorption of different nutrients. With a gastric sleeve, the volume of the stomach is reduced, but it functions in a very similar way to prior to surgery. Whereas we know with bypass, there are some changes, and certainly where there's a large part of the digestive system that's bypassed, that's where a lot of our nutrient absorption takes place. So we look at what the surgery has done and the benefits of that as far as our health picture, but there are other things that we need to do when we're looking at nutrient absorption now and the new way that the body functions as we're digesting food. So this little image here is also a digestive system. It's just in a diagram form, and it will show where the different nutrients are absorbed. So esophagus is obviously where we chew up our food and start to swallow, and then the food comes into the stomach. And this is where you'll see water, alcohol, copper, iodide, fluoride, and molybdenum are also players or absorbed. And then as you work through the different parts of the digestive system, duodenum, jejunum, and the ileum, we have a range of different nutrients that are absorbed and utilised in the body. So once we've had the surgery and we have interruption to these parts of our digestive system, obviously the function of that is changed. And that's due to lower levels of stomach acid with a gastric sleeve particularly, or with a bypass where the food and the gastric juices and the enzymes are meeting at a different point in the body, which is great as far as there is some malabsorption of energy, carbohydrates, fats, and proteins, which also helps to equate to weight loss. But it also leaves us with this malabsorption of some really key nutrients that will keep us healthy over the longer term. From the point of view of both surgeries, we see really common impacts: vitamin B12, calcium and iron are heavily affected because of the way the body usually absorbs those nutrients. So B12, before we have surgery, we have a little protein that's called intrinsic factor, which is housed in the stomach, and its job is to actually help with the activation and transportation of B12. So when these surgeries are performed, we find that that's either changed or it's actually removed. So a good portion of it is removed. We also know that once intrinsic factor is removed, the body needs to find another way of absorbing B12. So it's likely that prior to surgery, our daily intake of B12 it's needed is about 4 micrograms. And after surgery, the recommendation for a bariatric patient is about 350 micrograms. So the whole change in the way that we use B12 or we can transport and activate it in the body is totally changed, and it's much less effective. So the recommendation is for up to 100 times more for a bariatric patient on a daily basis, just to maintain that level. We see the same with iron. I know a lot of women in the audience will have been dealing with iron deficiency. It's possibly one of the most common things that we see. And even prior to surgery, that can be an issue with a bariatric patient. So iron needs to be taken on a regular basis, and anywhere up to 60 to 100 milligrams of iron for some women is recommended. Also calcium. Before surgery, calcium absorption is known to be from food. We take about 40% of calcium and we're able to absorb that. And we know that after surgery, absorption of calcium has been found to be as low as about 9%. So significant impacts, which mean that just to maintain our levels of those nutrients, just to make our bodies function in a way that we are accustomed to and maintain health, we need much more of each of those key nutrients, as well as the fact of we've reduced the volume of food, as well as the way that food is absorbed. So all these things come into play and can lead to nutritional deficiency. Which the main nutrients here, the long-term deficiency risks are calcium, we know, helps to keep our bones healthy. So osteopenia, which is just a precursor to osteoporosis, where we have porous bones or weakness in the bones. So falls and that sort of thing can be a lot more detrimental because the bones are quite fragile. Dental issues, and also calcium actually helps to regulate our heartbeat. So it's a really key function of keeping us well from a cardiovascular perspective. Vitamin D helps with bone mineral density loss, immune system dysfunction, and can be linked to a depressed mood. B12 will do a similar thing. A lot of the nutrients that are impacted will really heavily affect the patient's mood. Some people will feel kind of confused, or they have more anxiety than they usually do, or they're tired all the time. And this concert of different nutritional impacts will certainly contribute to a lack of energy, concentration, and also just a feeling of fatigue and confusion. So it depends on the gravity of the deficiency and how long it's been going on. We know iron can be connected to heightened anxiety. And while iron also makes us feel quite exhausted, it's one of those tricky ones where we'll feel really tired during the day and sort of drag ourselves through the day, maybe prop ourselves up with a little bit of carbohydrate to kind of boost our energy. And then it comes to bedtime and we're exhausted but can't stay asleep. So iron is a big player in sleep maintenance, and it kind of sets us up for a cycle where we're kind of tired but wired, and then we get up in the morning, we're still exhausted, and we're looking for those carbs sometimes just to give us a bit of an energy boost. So it can create this kind of vicious cycle of it's a bit of a sabotage against kind of the long-term goal really of the bariatric patient. Niacin, this is actually, I think it's meant to be thiamine, which is another major consideration. It's just an issue with the slide there. So thiamine's another one to watch. We've just increased the thiamine in our products as well, because we have been seeing that some patients are low in thiamine. Particularly in that early stage after surgery, it's one that's really important to watch, and it does have far-reaching effects, and it needs to be corrected as quickly as possible. And also we find that after surgery, some foods just don't sit well. So we have some patients who are eliminating different food groups, or some are trying new diets with looking at the outcome of improving health. So we're finding there's either different food groups are being eliminated, or different kind of ways of eating undertaken, so vegetarianism or veganism, which also makes it really tricky to meet those B12, iron, calcium requirements of the bariatric patients. It's where supplementation is, as much as we say supplementation is needed daily for a standard diet for a bariatric patient, it's certainly a vegan or vegetarian diet needs a really good balance of nutrients, and just a really a sound kind of regular look at the bloods to make sure that everything's on point. So we make a lot of our products based on this information, and we know that the research has been done to show kind of where these deficiencies lie in the bariatric patient. And the way we did that, we refer to the ASMBS nutritional guidelines for bariatric patients. And this has been around for obviously a long time, 2008, and it was updated in 2016. And it's a meta-analysis of all of the different implications of bariatric surgery from a nutritional standpoint. And it's used around the world as the kind of gold standard of care and nutrients, I guess the daily level of nutrients that a patient will need ongoingly. I've added the links here to that evidence as well, and there's some really good information from the Bariatric Times on supplementation and care of the bariatric patient as well. It's really worth having a look at from a personal point of view, how you can take on this information and sort of become an advocate for yourself to look at what your supplements have in them, just making sure that all the nutrients are there and they're going to suit you. And that's what sets the bariatric supplements apart from a general supplement, is the levels of these key nutrients that are now malabsorbed after surgery. So in our 10 years of producing the products, we've come up with a range of solutions for different times. We've got chewables, we've got the BN capsules, BN calcium and iron. We have a couple of flavors of the chewable vitamins now as well. And the chews are generally used directly after surgery for solubility and safety. So we know that there can be some swelling in the esophagus and that top of the, I guess, top of the stomach. And I mean, it is quite major surgery. So for 6 to 8 weeks, we encourage a chewable multivitamin for solubility and for delivery. So it just means that we know that once the product goes into the tummy, it's broken down really easily and it's assimilated well as well. Now, I know, Megan, you were keen to talk about a couple of questions that you've had on tolerability of products and that sort of thing. Did you want to cover that with me now?
Yeah, definitely. I guess as we're kind of preparing for this webinar, like I was thinking of, I guess, conversations that come up a lot during appointments with patients after surgery. So something I thought would be helpful to chat about today was, I guess, troubleshooting poor tolerance to supplements. So a common thing that might come up early in someone's surgery journey is that they are feeling nauseous after taking the multivitamin. So I guess just any kind of tips or advice you'd have for people experiencing that kind of poor tolerance.
And there's quite a few ways around that. And usually my understanding of it is that often it is a bit of it's the mix of all the different nutrients at once. And it's more often than not when it's going into either a new tummy or an empty stomach. So we know that the kind of the mechanics of chewing and swallowing food and eating sets off a whole lot of different processes in the body that gets us ready to absorb food. So I think directly after surgery, when we know that the gastric juices are scant and certainly stomach acid is low, when we're putting in like a whole multivitamin and not much food, and if you're on liquids and purees, often it is quite a light diet. It can just be simply that it's just the body's not sort of, that digestive process is not ramping up enough to actually do much with that in the tummy. So when that's happening, we just make sure that maybe taking the supplement directly after your food. And if a whole tablet is upsetting your tummy, you can break it up into small pieces. So we start out with halving it and just seeing if that will settle okay. And then if that's not the fix, we'll also recommend chopping it into quarters, and then you can take it sort of 4 times, spread it out a little bit so it's not quite the onslaught on a brand new tummy that to avoid that. It's generally the minerals, it's iron, it's a mixture of it as well. But definitely taking it with food is certainly a real benefit.
Yeah, amazing. We've had a few comments come in from our viewers. So Louise has asked, So she's saying she's taking the new BN double strength capsules. Is
Yeah.
it okay for the kidneys? Is it a slow release capsule?
It really wouldn't have much to do with the kidneys, in my opinion. I mean, I'm wondering if there's any ill effect after taking it. That's the reason we kept the 2 a day in the range, was we were aware that taking the whole lot at once may not sit well for some people. It's not much, we haven't had much feedback in that regard. Definitely fine for your kidneys, and definitely fine as far as the delivery goes. The ASMBS do recommend taking the supplements twice a day, which is why we've always stuck with a twice a day formula. But we also found that with the 2 a day, when patients are missing that second dose for the day, they are much better off to take the whole lot at once than to miss out on the second dose. So that's why we made the one solution. It's handy. It's in a capsule form. You can take one sheet and put it in your handbag, and you've got it wherever you go. For those patients who are definitely not taking the 2 doses each day.
Yeah, I completely agree. I feel like the feedback's been really great to have the option. And I guess with the 2 a day, being the capsules are a bit smaller, that's for some people preferred for swallowing. Yeah. But in the sense of I guess the burden of having quite a few potential medications and supplements to take, one less can be helpful for some patients. And we've just had another comment from Claire saying that I find when I take any vitamins or supplements, I feel very unwell, and it puts me off taking the supplements. And she's nearly, she is 4 years post and still having that problem. So, yeah,
that's a sensitive tummy, isn't it? And I wonder if we've tried breaking them up into quarters. That's my main recommendation, is just, if it's 2 chewables you need to take each day, you might need to take 8 small doses. And the other thing we have is an iron-free formula. That might be something that you explore, because it can be that iron. And so when we do find there's a prevailing discomfort, we'll often take that iron away and see if that's the fix as well. So there is an iron-free capsule. It's got everything in it that the normal capsule has in it, obviously without the iron. And that might be the next way to go. Also, just wanted to say that if these issues are current for patients who are using the BN Healthy range, we offer a full swap out guarantee. So if anything's not working for you and you're putting off taking your supplements, we'd much prefer you to reach out to us so we can find a solution for you and get you back on track. And we'll tweak and see how things work, and we'll send you samples of different products and that sort of thing, just to find that sweet spot for you. It's certainly something that's really important to us and to your team, is that we're getting those nutrients in as best we possibly can.
Yeah, exactly. And I think that's so beneficial that you guys are so flexible with that, and actually happy to do returns and swaps, because it can feel like a bit of a lot of trial and error when you're going through, the capsule, the chewable. It's like you keep purchasing, trying to see if something sits well. So I think that's, that option is really good.
And it can be, some people have absolutely no problems at all with, protein, anything. They can just, have their surgery and keep going. And others, we just need to find that little workaround, and it's totally individual, but we're happy to help you with it.
Yeah. We have a few more questions coming through. So Shally has asked, does it matter what time you take your multis? If 1 a day, I do calcium meals and calcium supplements across the morning, and early afternoon vitamins in the evening. So separate.
Sounds like a good regime. The research I've read, and correct me, Megan, if you've heard anything different, is that when we're combining minerals, they do become competitive. So we know that calcium and iron can compete. My reading shows that calcium that is higher than 400 milligrams will begin to compete. So in our multi, that's not a problem. We know that we've balanced that out quite well. The calcium is low enough so that the iron will be absorbed. But if you are taking, actually, I will send it to you, Megan. We've got a timeline for when we're mixing supplements. of like when to take iron, and if I'm combining calcium, when do I do that? The recommendation is about an hour apart, just to make sure that there's not that conflict with the two. Sometimes if people are taking extra calcium, I'll encourage them to do that at night. It's really helpful for sleep, and obviously it regulates the heart rate and that sort of thing. So it'll help you to have a nice restful sleep as well.
Yeah. I definitely feel like a handout or like a visual of timing would be helpful. But
yeah, I've definitely got that.
Yeah, I agree. Timing wise, like I generally will recommend minimum 1 hour for the calcium and the multivitamin because of the iron absorption.
Yeah, and I think they say 45 minutes, but I just like that little bit of extra time.
Good to play it safe. And I think often I would say as well, it's like taking too many supplements at once is also risking then you feeling nauseous as well. So like spreading them all across the day is helpful for tolerance too.
Yeah, absolutely. Yeah, for both absorption and tolerance, definitely. And with a meal, your body's ready for it as well. So if you take it at the end of a meal, or some people take it when they're brushing their teeth at night, if it's calcium, it's like I like to pair habits. So we know that our brains are very good at associating, like we used to associate eating, TV snacks on the couch at night, and we'd go, where's my snack? So we know that the brain is very good at looking for I'm in my car, what do I do when I do that? So we pair these habits that we need to instill with something that we do every day, and that means that it just becomes kind of second nature. So often with the 2 a day, or the people who are buying 3 bottles, I'll encourage them to put a bottle in the bathroom and maybe a bottle on their desk at work or on the bench at home. If they're in your vision, you're likely to go, oh, I've got another dose to take, I'll take that now. So it's just setting yourself up for success and kind of pairing it with other things as well.
Yeah, I think that's great advice and something I talk about a lot too, because as you're kind of starting out on your surgery journey, there are so many changes and new habits you're trying to build. So trying to make it as simple as possible to remember is really important. Yeah.
And that's kind of where we've gone with making things a bit yummy as well. We know that there's medication and supplements, and some patients have got quite a collection of things that they need to take. So we've introduced, BN chocolate and BN fudge to make things less, I guess, we call it pill burden. So it's like, oh, I've got another tablet to take. At least it's something that if you're having your BN chocolate, you can have it in the afternoon with a cup of tea, and it kind of feels, like a little treat as well as doing something good for your health.
Yeah, 100%. Tracy has asked if you ship to New Zealand.
Absolutely. We also have distribution in New Zealand. We're also the leading bariatric product in that country. And we've been in New Zealand for maybe 6 years now, I think. So we have a New Zealand website. What we do have is in New Zealand, their regulatory is quite strict, and the most B12 we can put in a product in New Zealand is 50 micrograms. So our New Zealand range have a much lower B12 level, and they also have less folate. That's also a restriction over there. And so for that reason, we also encourage people who are looking for that stronger dose of B12, they can certainly order from Australia and ship it into New Zealand. But yeah, we're certainly across the ditch quite often.
Yeah, awesome.
We have local, all our protein and that sort of thing is available in New Zealand. It's warehoused there.
Yeah, amazing. I guess for the interest of time, we'll probably run through a few more questions and then we can call it there as well.
Yeah, I'm happy to answer questions more than kill you with, death by PowerPoint. And I'd like to share the slides so you can read them in your own time. But the more we can answer specific questions, the better.
Yeah, definitely. I'm not sure if this one is kind of in the field of today's topic, but Leanne has asked if we could share any knowledge on the effects of collagen on gut health.
Yeah, we certainly can. And we know that there's a connection there with collagen and gut health. I've actually got a collagen guide. I've gone 2 different, because collagen is actually a really prevalent product in our realm, and I believe it has its place I understand it's great for gut health and hair and skin and nails. I just like to look at the long-term goal of the patient, and that's often weight management and muscle retention and feeling fuller for longer. And that's where the whey proteins will definitely come in over and above the collagen. Both have a job, they just do different things. And collagen's great for our connective tissue and our skin. And certainly it helps with what we call the tight junctions in the mucosa of the intestinal tract. So it helps with healing the gut. And also when that is happening, we've got less of those unprocessed or undigested foods that can leak into the bloodstream and cause immune response as well. So it does have its place for gut health. I've got a really good article on that also. I'm really happy to share it.
Yeah, awesome. That would be great. Yeah, we'll definitely pass this on to everyone after today's webinar. It looks like everyone's going to have the slides as well, which is great.
Yeah.
So just had another comment from Shelley saying she's tired every day, a year post-surgery, was told bloods were good, but never told to stop vitamins 48 hours before bloods. So wondering if her blood results could be off.
I like to look at whether our supplements are doing their job. So when we test bloods and we're supplementing, we're often testing floating supplements. And I like to see whether it's actually having its impact in the cell. So you're right. I think there's a window of about 3 days where sometimes we'll stop taking multis just before we're doing blood testing. So it is a good thing to do. The other thing I often hear is that patients will have their bloods tested with the GPs and they are supplementing, and then the GP will say, well, your bloods look really good, you don't need to take your supplements anymore. But it's like, that's why my bloods were really good. So also know that, yes, it's great that your bloods are good, but it's also that's the reason that they are good is because you're taking your supplements. So I think, if anyone else outside of your kind of close bariatric team is suggesting to change anything, always go back to, the voice of truth or the the seat of your advice, and just make sure you're getting that advice from someone who's really specialised in bariatric care is my recommendation.
Yeah, completely agree. I find it is quite a challenging one where you do have patients seeing other healthcare providers that don't specialise in surgery, and they're changing their supplement plans. So, I always try and advocate for everyone to really speak to their team, because we are following, obviously, guidelines and, putting you on a plan for long-term, like minimising deficiencies, not just in that moment. So.
Yeah, good point. Good point.
Do you feel like there has any link between, Louise has asked, constipation and the collagen protein powder at all?
That's a good question, and it could be individual. Collagen twice a day, I don't know about that. I would look more towards fibre intake and water, and just have a look at the broad diet. I think we can get caught up on just one or two things when we're looking at the cause of something. In my experience, I haven't seen collagen to cause constipation, but everyone's different. So it's something that you could certainly experiment with, removing it and then bringing it back in. It's always good to challenge it and see if that is the cause. But generally, with constipation, I would certainly look at fibre intake. We're eating a much higher protein diet, and that can be the cause. And that can just be the connection is that we are eating a higher protein diet, just has less fibre. So often just a little bit of a fibre supplement, or being aware of including foods with some extra fibre is a good approach. And just, it's a juggle. It's like, meet your protein goals, take your fibre, take your multis and drink enough water, but don't do them all together. So it's a real, it's really being aware of time management and when to put these things in as well. Yeah.
Yeah, definitely. And I'd say in that situation, like, good to have a review with your dietitian as well if you're wanting to chat through that on more personalized level, because exactly, like, you might need a review of your supplement, like fiber supplement, intake,
Yeah.
and even your diet as well. So yeah, like, would be a good time to check in with your team too.
Absolutely. I recommend that when anything changes, like when anything is different and it's unusual, it's just a really good thing to, instead of driving yourself nuts with what is the problem here and trying this and trying that, often just that one little consult with your dietitian, they'll be able to see it just from that perspective and set you back on track pretty quickly. I do find that a lot of patients will kind of try and work things out over the longer term and ask in the group and check things out. And then by the time you could have had that consult, I think the problem might have been solved a little faster. Yeah.
Yeah, very true. So I guess we'll be wrapping up today's webinar, and I really hope everyone got some valuable information out of today. Definitely covered some really important topics that really kind of paint a picture, I guess, of that journey of the overall benefits of surgery, but what we need to kind of put in place to make sure there's that long-term health aspect when it comes to
absolutely.
But yeah, we'll definitely share. Everyone will get a recording, and we'll also share the slides from today as well. But yeah, feel free to reach out if there are any other questions or any other topics you'd like us to cover as well.
Thank you. And also just to note, our website, the Being Healthy website, has all sorts of resources, recipes, blogs, all that sort of thing. So there's generally, if you've got a question either about the products or about something related, you'll find something there. And also my podcast, the Australian Weight Loss Surgery podcast, is often a good source. We've had your team on there just recently. We talked about with Jennifer and your psychologist. It was a really good episode. So also lots of resources that we provide, and just helping the journey to be a little bit less long and winding and more of a straight line towards success.
Yeah. Well, thank you so much, Jacqui. It's been lovely.
My pleasure.
Looks like everyone is saying thank you as well. So
Thank you.
We'll end here, but everyone enjoy the rest of your day, and we'll be back soon.
Thanks. Thank you for having me.
Thanks.
Have a wonderful afternoon. See you guys.
Bye.